Okay, so I'm with, as I said before, Surface Creek Family Practice. We have 2 locations. That's our pretty sign outside of the Cedar Ridge location, where I'm 100% to where I'm dedicated. We have 6 medical providers, 2 behavioral health counselors. All 6 providers go back and forth between Delta and Cedar Ridge. They have 2 days in Delta, 2 days in Cedar Ridge. But the behavioral health, we call ourselves integrated health counselors. We didn't like behavioral health. It sounds like somebody's in trouble and in timeout for their naughty behavior. So we went with integrated health counselors. And my colleague Lundell is full-time in Delta, and I'm pretty much full-time in Cedar Ridge. We have about 3,000 patients. And we were fortunate enough to get involved with several initiatives a long time ago, Beacon Health, some consortium, something like that. Okay, so I'll go into some of our process developing into who we are today in another slide. But I chose this slide to demonstrate that primary care plus behavioral health equals, and I'll just let you look at it for a moment. So we have administrator looking at it one way, we have a physician owner looking at it another way, and then in walks a behavioral health provider. I was the first hired about 2 years ago, and I was coming straight from my lifelong dream of being in private practice. I had 1,200 square feet. I had my own play therapy room. I had my couch, a plant, armchairs, a Keurig machine. So it was the deluxe experience. If you came to see me as I said client then. I've learned to say patient now. So then I had my own ideas. And I happen to have the same quotation that Kyle showed according to CJ Peak and the National Integration Academy Council and the Agency for Healthcare Research and Quality in a 2013 paper. Why? What's the point? To improve patient care, lower healthcare costs, and improve health of the population we serve. And then that's the rest of the quotation that you already saw with Kyle's presentation. Sorry, did I call you Kyle? Okay, so learning points I was hoping that I could share is that in my estimation, there's some key elements in my experience in the last almost 2 years. Number 1 is the leadership and the leadership's mindset. Number 2 is can people be flexible? Number 3 is resisting what I'm calling homeostasis, and I'll get to that. And then sustainability. So regarding the leadership mindset, show of hands, who's ever heard of the book, Who Moved My Cheese? Okay, so many of you know that it's a fable of a business that I won't tell the story. It's basically what we're doing right now, trying to move from fee-for-service to being paid for, this population health and quality improvements. So I feel like leadership mindset is really key. I should have had this slide earlier. So here's our journey. Surface Creek Family Practice did 2 years of the Colorado Beacon Consortium, 4 years of CPCI Classic, Co-Earth, 6 months-ish, and we got certified. CPC Plus, we're involved in that track 2 for the next 5 years, and we're waiting on pins and needles. We want to be in cohort 2 really badly for the sim. I've been talking with Barbara. Please, please, please. Surface Creek is great. Okay, so now back to mindset. The therapists in the room will know about this study that was done in a university, but it's basically that we kind of either are fixed in our ways, like old grouchy grandpa, or we believe we can change. We have the abilities to change. And so we need folks with a growth mindset. So we started with having a wonderful consultant trying to help us with this. She happened to be my clinical supervisor when I was an intern at St. Anthony's North Family Practice Residency Program at St. Anthony's North Hospital in Westminster, Colorado. And Dr. Billington taught at CCU, but she also was getting her, I forget what you call it, but it's a certification for a psychologist to prescribe psychotropic medications. And her internship for that was at the family practice. So I wasn't looking for an internship in family practice. I didn't know anything about integrated care, but I got to experience that for 8 months. Other resources besides her, there's a really good book, and I hope you guys can get these slides, Integrating Behavioral Health into the Medical Home, a Rapid Implementation Guide. That was really helpful for us, or for me. You know, I was studying all this when I first was hired on. I never saw a patient I didn't see a patient for 3 months. I was just my nose in a book. And Integrating Behavioral Health into Primary Care is another good resource. I tell you, probably the best resource is we spent, then it was $1,800, now it's $1,600 to get certified through the University of Massachusetts, and you mentioned Sandy Blount. He's so wonderful. So I have 34 hours, and I'm certified, or ask my husband, I'm certifiable, but that was very helpful. 32 hours with didactic training is online, and I think it'd be money extremely well spent. It really shaped how I handled changing from the 55-minute therapist with here's your coffee to 5 minutes, okay, let's do some solution-focused work, some cognitive behavioral work. Let's be pragmatic. Then we got a co-earth certificate, and it was fun to see Alex and everybody up at the Learning Collaborative in June of 2016. We're growing. Okay, so your leadership, your key leadership, either a physician owner or if you're owned by a hospital system, whoever the powers that be, Jason Kleckler, I don't know, have to be interested in going ahead, and the cheese has moved, so we've got to go through the maze and find it. So I have my little Gumby doll, because one of the things that we've found in trying to navigate implementation of integrated care is we all had to learn to be patient with each other and flexible. And as that slide showed, the magnet with 3 prongs on one side and the 4 prongs on the other, each professional comes into integration with their training behind them. And so you've got the traditional medical training, you've got the therapist training, and administrators with their unique perspective on dollars and cents, of course. And we just, what did I say here? Our core values, influence behavior, blah, blah. Okay. Oh, wait, this one's fun. The packages came in and said, we're fun and we're flexible. So there's your sad medical provider saying, I'd rather just trip it off to a therapist and not have to do motivational interviewing or whatever you're calling that. So this slide is kind of like Kyle's. So we've got the exam room where you actually, Mike Olson taught me to write on the paper of the exam table if I'm trying to demonstrate something, where it's very clinical. And then some of us come from the traditional mental health setting with the plant and the lamp and everything. And it's a clash of 2 cultures in some ways. So in our practice, we are not separate. I'm totally embedded, Lendl's totally embedded. We're employees. So I think we're fully integrated. But at the beginning, I said, you mean to tell me that while I'm with a patient, there could be a knock on my door That is not okay for most of us mental health professionals, not okay. However, now I'm in integrated health, and it's cool because I've gotten flexible. Oh yeah, and then going from the 55-minute hour to 5 to 30 minutes is a struggle for many professionals. Not me, no, I didn't have trouble with it at all. I don't still do 45-minute sessions. Oh, and then motivational interviewing. So I had this slide prepared for, I was doing a talk on motivational interviewing, and I thought it kind of speaks to physician buy-in. And so there's a quote from one of the books, Integrated Behavioral Health and Primary Care, that they're quoting motivational interviewing. When signs of resistance to change are observed, the skilled motivational interviewer attempts to accept resistance rather than confronting it head on. And I have a story about this. And as we were learning to work together, I'm getting tired of being on my tippy toes. Okay. Thanks. Okay. So quick story on this resistance to change and motivational interviewing and the differences in medical school training versus the mental health professionals training. So one of my providers referred a patient, not referred, but just said, I want to work together with you on helping this person quit smoking because she's had a stroke and she has COPD, and let's see if we can motivate her. But I've had her as a patient for 10 years and she's never smoked one fewer cigarette per day the whole time she's been a patient of mine. So, okay, thanks. So I worked with her, and she went down from 3 packs a day to 13 cigarettes a day. And then she came into my office for a follow-up one day, just boiling mad, and she goes, I am so mad. And she was so mad, she said, at the provider. Why are you so mad? He told me I have to quit by my birthday. And so later I had a conversation with the provider, and I just talked about rolling with resistance. So anyway, okay, 5 minutes. We've got a couple good slides here. So homeostasis happens sometimes when the program is not being looked at like for a while we had an administrator who was just like really invested in every moment and lots of meetings and all this. And then, I don't know, she's retiring or something, and then it just kind of stopped. And so then the providers and myself kind of started reverting back, oh, nobody's watching, I'll do this session for a whole hour. And so equilibrium, we kind of started going back to our old ways, and we changed EMRs, nightmare. So we stopped doing the patient stress questionnaire, and we need to get back. Since I only have 5 minutes, I'll only show one of the sustainability slides that I prepared. According to Kathy Reynolds, a senior consultant from SAM HSA, Center for Integrated Health Solutions, while financing is critical, it's only one component of what makes integrated care stick. She cited leadership and mission, strategy, technology, clinical workflows, financing and billing, health, homes, and quality improvement. So we kind of look at our processes. The integrated health counselors add value that's hard to capture sometimes. I support the providers when they've had a rough day or a rough encounter, and employees the same. And so Lendl and I, anyway, think there's value in having us, even though we're licensed professional counselors. Not even though, wait a minute. We have value too. Okay, so last slide, this is our mission. We provide whole person care, which means we coordinate and integrate all aspects of your healthcare needs. We're becoming a patient-centered medical home because your overall well-being matters to us. All aspects of your care will be well coordinated, including visits to specialists. Our provider team consists of medical and mental health professionals, and you are the most important member of your team.